This is the FCPS reopening of schools part 2. These are our plans for fall 2020. And I'd like to go to the next slide and share with you our outcome for today. We're going to review the school scenarios briefly again with you. We're going to provide responses to requests that this board had on June 15th at the school board work session. We're going to provide a timeline for the key decision points that has not changed. We do need board consensus today and board discussion on number 4, the reopening models that we're presenting to you today, and on our reopening school budget needs so that we can go forward with the staffing and supports necessary to ensure that we can return to school in an effective manner this fall. If we can go to the next slide, these are topics from the June 15th work session. We covered a lot in the last work session. A lot has happened already in a week, and we have links to this that if you need to go back to look at some information that's not brought up today, it is there for you and is available on our website as well. At this point, I'm going to turn it over to Dr. Ivy just to go over for a moment the task force structure again and share our guiding principles. Dr. Ivy.
Thank you, Dr. Brand, and good afternoon, members of the board. I just want to take a moment to remind the board and the public that our action teams will continue.
Dr. Ivy, we can't hear you very well.
Yes. Can you hear me?
That's better. Thank you.
Okay, thank you. All right. I just would like to take a moment to remind the board and the public that our action teams will continue to develop and refine the details of our plans during the next few months. And they will be taking into account current local health data and guidance from our health department, the CDC, the state, along with the continued feedback that we receive from the school board and the public. Move to the next slide. Also want to share with you that our task force will remain intact, and we will be meeting with this larger group of diverse stakeholders every week to answer questions, to gain input and suggestions and get feedback. And lastly, going to the next slide, I just want to update and really remind you of our guiding principles. You will see throughout this presentation that on some slides, you will see red lettering, and the red means changes or adaptations that we've made. So we will continue first and foremost to ensure the safety and health of our staff and students. As you can see in number 2, and Dr. Brabrand, when he introduced, shared that we are maximizing family choice in student learning, and you'll hear more about that. We continue to ensure and want all students to receive a high quality instruction with necessary supports to include access to technology and connectivity, social and emotional wellness and health, and also additional supports to meet the needs of our special populations. We've added in additional flexibility for our staff into our plan, and we certainly want to provide proactive, clear communication with translations to all families and staff. So with that said, we're going to get started with the actual details and updates of our reopening of schools plan. And I turn it over to Dr. Presidio. Oh, we got one more ask. So back to Dr. Brabrand first.
Thank you, Dr. Ivy. I just have one final comment to make right out of the gate. What I am asking for today from the school board is to support my recommendation to provide choice to families to the greatest extent possible so that families can request to attend a school with social distancing, which is scenario 2, which will be the default. Or families may request, and we'll be reaching out to them later this week after school board consensus today, for the option, if they would like, to enroll in full-time online for the school year, the entire school year next year, which is our scenario 3. That is additional flexibility than what we had provided last week, and that is what we're asking for today. The moving forward with scenario 2, our 50-50 plan with social distancing, and allowing families to choose scenario 3, full-time online learning for the entire year. I'm also going to be asking this board today to move forward to support additional flexibility and choice to staff to the greatest extent possible for staff who would be able to request to teach online for the school year. And we would prioritize those staff that had individual medical need, those with family medical needs, or those that would simply prefer to be teaching in a virtual online presence. And we will do our best to match up those teacher preferences to the demand that our families choose around virtual learning. We also need today from the board your support for spending our COVID-19 reserve and our CARES Act budget priorities so that we can go forward with hiring the staffing and purchasing the supplies and PPE that we need to be successful in both of these scenarios for the coming fall. And now I'm going to turn it over to Dr. Presidio, who is going to go through the other parts of the presentation, and including a conversation with our health department colleagues. So Dr. Presidio.
All right, thank you very much, Dr. Brabrand, and good afternoon to all of our board members. I just want to start by extending a special thanks to Ms. Pekarsky and Ms. Sizemore-Heiser, serving as the meeting managers for not just one meeting, but 2 meetings on this topic, and really putting in a lot of overtime, working with staff in the evenings, at night, and during the weekend. So thank you very much for all of your work in helping us pull this presentation together. I am very pleased to have the opportunity to present part 2 of the presentation, as Dr. Brabrand mentioned. This is a continuation of our June 15th board presentation, and we really have appreciated all of the feedback that we received on the presentation from the board members, from staff members, and from community members. And we've really tried to revise our reopening plans, as you'll see, in accordance with that feedback. So I will try to touch on certainly the new information, but also some of the major key elements of the reopening plan in general as well. So I'll do my best to go through this as quickly as possible, but there are a lot of important points that we want to make sure that we hit. So to start out with, as we discussed back on the 15th, we have been collecting a lot of information about the challenges that we experienced with distance learning in the spring. And we're doing that, of course, in an effort to really build a reopening plan that's going to be responsive to our student and staff needs in the fall. So we've certainly learned a lot. On the instructional side, for example, we know that we need to have consistent implementation of our schedules across all of our schools. We need more synchronous learning time for students to connect with their teachers. We need more social emotional supports as part of our core academic program. On the equity side, we know that we have a responsibility to ensure that all students can participate equitably in distance learning. So we need to ensure that technology and connectivity are provided to all students. We also know that there has been a disproportionate health impact of COVID-19 on certain communities and certain student subgroups within Fairfax, and that's going to widen the achievement gap. So we need to be thinking about how to mitigate that when we have students back with us this summer and in the fall. On the communication side, we have to have a lot more opportunities for two-way communications. Our communications have to reach all families, and those translations and oral interpretation services are critical to make sure that all of our stakeholders and families have the information that they need. Additionally, we know that teachers need a lot of support to make distance learning happen. They need dedicated time to plan individually and with their colleagues. They need opportunities to include a full curriculum, including specials and electives, into the instructional day for students. And we need grading policies that really reward and incentivize student participation and engagement in learning. Again, on the technology side, in addition to having the devices and connectivity, we know that we need to ensure that we have a reliable learning platform and video conferencing platform that students can access in a safe and secure way. And of course, our staff needs a lot of support. So They need access to childcare in many instances to be able to work effectively, sustained professional development in areas like blended learning strategies and how to incorporate social emotional supports. So we really have tried to incorporate our responses to all of these lessons learned in the reopening plans. And we'll touch on some of them throughout the presentation, but there are a few that are so important and really key to our reopening plan that I wanted to touch on those in a little bit more detail. And the first is really a commitment to provide the maximum amount of flexibility that we can to support student and staff choice next year. So when we think about providing an option for any student in our revised plans to request online learning for next year, that's really a commitment to providing that student and family choice. Additionally, as Dr. Brabrand mentioned, we want to allow any teacher to request a full-time online teaching assignment next year. Those placements will be contingent, of course, based upon the student needs. So for example, if we have a school where more students are requesting in-school learning than teachers are requesting virtual learning, that's not going to be a complete match. So we are going to have to base our teacher placement decisions on the student preferences for learning format for next year. And additionally, as Dr. Brabrand mentioned, we would make those teacher placement decisions in a tiered format, recognizing and granting individual teachers' medical needs requests first, those teachers that have family medical needs, and then those preferences in that order. But we do have a commitment to providing that opportunity for staff to request a full-time online teaching assignment, and we'll work really hard to honor that wherever possible. We're also committed to providing flexible leave and telework assignments for any of our employees who are at high risk of illness. And then in any of our school operating scenarios, we're going to ensure that we have consistent implementation of division-wide instructional schedules that would provide more synchronous interactions between students and teachers, and again, on a reliable, safe, and secure learning platform. Attendance and grading are also going to be required in any of our operating scenarios next year, and we're committed to continuing to provide laptop computers and connectivity to the students and families who need it. So as we mentioned, we did receive a number of requests from board members for additional information, and those are referred to as next step requests for information. So the first next step that we wanted to address was the request for more information on how other school systems, either locally, nationally, or globally, are approaching the reopening process. So first of all, we have been collaborating on a regular basis with the school systems in the Northern Virginia region. And we've been meeting weekly to really collaborate and coordinate our planning efforts. Additionally, the superintendents have been working very hard to try to come up with opportunities to engage the county executives and chief administrators to coordinate not just school operations, but also county operations with respect to all of our returning to school work. So unfortunately, even though we've been collaborating a lot with our colleagues, a lot of our school divisions in the Northern Virginia area still have not really developed their plans. Loudoun is probably the closest in terms of having had similar conversations with their communities as we have here in Fairfax. But you can see on the other end of the continuum, Prince William County is not even really going to be releasing their plans until mid-July. So there's not a whole lot of information that we can report, but we're happy to provide more details and discuss this more if there are additional board questions. But we've been working very closely with our colleagues around the region. Additionally, Fairfax is part of a large consortium of large suburban county school divisions. Among those school systems are some of the largest really in the country, including divisions like Baltimore County, Charlotte, Gwinnett, Montgomery County, Palm Beach, Wake. And we've been meeting on basically a weekly cadence since February to really try to support each other with both distance learning during the spring and now reopening plans for the fall. Again, there's not a lot of information that other divisions have released yet. We'll certainly make that information available to the board as it is developed. A few of our colleagues are developing plans that we thought might be worth noting. For example, Gwinnett County in Georgia actually is going to start school on August 5th. So they have a very early start there. And they're actually looking at a start completely digital with having opportunities to just bring in small groups of students as they can transition back into more in-person instruction, and social distancing guidelines will be eased. But they're really out in front of the other divisions because they have the earliest start date. Both Bellevue and Wake County are considering similar reopening scenarios and operating scenarios to the ones that we're looking at here in Fairfax. Also, at the last meeting, we had shared some information on international examples. Again, you see there's some similarities with what other countries are doing. For example, reducing in-school capacity and social distancing is pretty much happening in all of the international examples that we've looked at. But there's also some variance. So when we look at things like health screening protocols and processes or policies for students wearing masks, you'll see some differences across different countries. So that's some of the background information we have, and it's not nearly as robust as we would like it to be, but everybody's just really, I think, in the process right now developing and finalizing their plans. And in terms of us developing our plans here in Fairfax, the most important thing, of course, is to make sure that we can open in a safe way to ensure the health and safety of all of our students and all of our staff members. So the approach that we've taken is to follow the CDC guidelines for reopening. And Virginia's plan, as announced by Governor Northam, does ask all schools divisions in the state to follow the CDC guidelines. So just very quickly, we reviewed these at the last meeting, but just to touch on a few key points, the CDC guidelines are basically set up as a decision tree, and it requires you to be able to address certain items before you go to the next phase of your planning for reopening. And the first phase of thinking about reopening is making sure that your reopening plans are consistent with any local and state guidance. So it's really important that everybody in our community understands that any of the final decisions about the details in our plans regarding reopening as it pertains to health and safety are going to be informed by the local health data that we have in partnership with our colleagues in the Fairfax County Department of Health. And we've really appreciated having them be so actively involved in the task force and helping us develop our plans. And we'll continue to work with them as we need to make these critical decisions and develop the details in our plans. Additionally, the CDC requires that you're able to have policies in place to really ensure and protect either staff members or students that would be at high risk from COVID exposure. So again, it's really important here that we're saying that in Fairfax, we would provide a full-time online learning option to any student who would request it next school year. Additionally, we would have flexible leave and telework assignments for employees who might be at high risk. But also, again, we're working to ensure that any teacher has the ability to request to be assigned to a full-time online teaching assignment next year. And again, that has those contingencies that we discussed earlier about student enrollment need and the needs of staff members. Also, the CDC requires that you're able to screen students and employees in a way to ensure that they're entering the building safely without any COVID symptoms. So again, this is an area where we're going to continue to partner with the county health department to really refine what those screening protocols would look like. But we do have plans for a daily screening process for both students and staff that would require a daily report to ensure that students and staff are not symptomatic and have not been exposed to anybody who's symptomatic for COVID-19 prior to entering the building. Additionally, the CDC requires in the second phase that you can have health and safety protocols in place around hygiene. So we talked last time about the hand washing guidelines that we would have, also face coverings or masks. And again, on that item, we know that there's a lot of discussion that we need to have as a community, so the final details are not worked out. But here are preliminary recommendations are that masks would be worn by staff and students when developmentally appropriate, when social distancing guidelines can't be maintained. So we recognize in certain instances, based on a student's age, and based on the instructional need, for example, if we're working with English language learners and English language development courses, or students who are receiving speech services, just as two obvious examples, a mask is not going to be appropriate in that instructional situation. So we'll continue to work to refine those guidelines, but these are our preliminary recommendations that masks would be worn by staff and students when developmentally appropriate, and we would provide masks to students who could not provide their own. We've also had a lot of questions about cleaning, and I think it's really important for everybody in the community to understand that we will be ensuring daily cleaning and sanitizing in our buildings, particularly in high touch areas like doorknobs and handles. And we have the ability to also bring in additional contracted cleaning services if we need additional help with deep cleaning should the need arise. But daily cleaning will happen in all of our schools. The other component of health and safety guidelines requires us to look at social distancing. So again, we discussed this last time, but we are finalizing our social distancing guidelines to ensure separation in classrooms and on buses. Also ensuring that we're limiting student groups mixing between groups. So really thinking about things like having students eat meals in the classroom whenever possible, and then in the classroom spacing our desks in a way to promote safe and social distancing practices. And then finally is the monitoring component. And again, here, we just want to point out that we'd be working very closely with the county health department authorities, looking at metrics like cases, exposure rates, hospitalizations, and any other relevant metrics that the county health department requires for us to consider whether or not there would be any need for us to have a change in operating status, either in a particular classroom, in a particular school, or across the entire division. So that would be work that would be done in collaboration with the county health department authorities. So we had a next step request that wanted some additional information, as I mentioned, on the health screening protocols that we would be using. And as I mentioned, those are still under development. Again, Virginia's reopening plan does require those daily health screenings following CDC criteria. But again, we have a work group right now made up of staff in Fairfax County Public Schools working with the county health department to finalize those protocols, both for the screening, the daily screening, the reporting, and the monitoring. And we would be working to try to provide the final details to the board and the community by July 23rd. So you see on this slide, these are some of the items that are currently under consideration. So when we think about the daily health screening form, we've got different ideas about how we might do it. It might be a hard copy form. It might be something that's electronic, like an app. It might be something that students could wear, like a lanyard. So there's different opportunities for us to consider. We're also thinking about on the bus guidelines in terms of students. We would ask students to wear masks on the bus, but we would not require students to have a daily form to get on the bus. We know that we had some concerns in the community about leaving students at a bus stop. We would not do that. We would allow students without a daily form to ride the bus using those additional health and safety protocols like wearing masks, and then we would assess those students at school as needed. So again, these are just some of the preliminary recommendations being finalized with the health department with the goal of having those final details by July 23rd. So that brings us really into the section where we'd like to discuss the different school operating scenarios with you. And of course, you'll remember that there are three main operating scenarios that we're looking at for next school year. And the first would be virtual learning for all students. So in this scenario, students, of course, would not be in the building and we'd be using distance learning. But the important point here is this scenario and this approach would only be used in the event of a school closure or a division closure based on a resurgence of COVID-19. So we're not considering that as a reopening scenario. That's a contingency plan if we have to use it. So we have two different scenarios for reopening schools in the fall then, and scenario 2 is the first of those. And this would provide in-school instruction with those health and social distancing guidelines. And the goal here is to provide that in-school instruction as frequently as possible to any family who requests it. But of course, based on state guidelines around social distancing, we're quite likely to have a reduced in-school capacity, which might require us to have additional bell schedules and modifications to student schedules, perhaps only being able to have students attend on alternating days. So students and families would have the opportunity, if they felt more comfortable, to return to school under scenario 2. But if they felt more comfortable to have a full-time online learning program, they'd have the ability to make that request under scenario 3. And again, we would not limit that to students with medical need. Any student who felt more comfortable in a full-time online environment next year would have the opportunity to enroll in that program. We would request a year-long commitment so that we can ensure that we can provide services to all the students who request it throughout the year. And also, we're not able to guarantee all of the program requests or special elective programs in course offerings based on the need to make sure that we can schedule students as flexibly as possible to meet the needs of the majority of our students. So those are the 3 scenarios. We're going to take a look at each of those in a little bit more detail. But before we do that, just a quick reminder about some of the elements that are going to be present in all of the scenarios. The first is that commitment to technology access and connectivity for anybody who needs it. Additionally, we're reworking our assessment program so that teachers will have the ability to have a very good understanding of individual student learning needs. We're also revising our curriculum, and we're going to provide very streamlined curriculum guidance, resources, and materials to all of our teachers to help them really focus on the most important concepts and skills, both from 4th quarter of this past school year, as well as next school year. And we want to provide digital resources as well that will provide some opportunities to support learning activities on asynchronous days and reduce the amount of additional planning that our teachers will have to do. We're also developing enhanced social emotional learning and wellness curriculum resources and materials that can be used in all of our schools at all of the various grade levels. So those things are present in all of the scenarios, as well as a focus on ensuring equity. So we know that we have certain student groups that have additional instructional needs that we need to be sure that we can meet. And we're really committing to provide those additional supports and services to students next year in special education with increased synchronous instruction, really making sure that students are included in the least restrictive environments, and being really flexible with our procedures wherever possible. For example, convening special education meetings virtually to ensure and expedite service delivery to our students. For our English language learners, we want to ensure that all of our students have a minimum amount of English language development time built into the schedules and to all of our schools. And we want to work very closely with our families. So we've got plans to further our outreach efforts and further our ability to communicate with families in their home language through things like bilingual counseling sessions, social work, and psychology services for our families. And then the intervention services, we have a lot of additional funds that have been identified as part of the CARES Act budget request that we have in front of the board right now to provide for those academic and support services that would occur throughout the school year next year. And all of that is really focused on a systematic approach to supporting students based on our work around multi-tiered systems of support, both in academics and in social emotional health and wellness. And we had a number of next step requests for more information on what those academic supports and social emotional learning supports would look like for next school year. So just real briefly, we are planning, again, to use that multi-tiered system of support approach, and we have been using it since this spring. So I want to make sure that all of our community members know that our schools have done a tremendous amount of work this spring using a 3-staged approach to first, in stage 1, identify students that might be at risk in fully participating in distance learning and working to try to make connections with those families and get them the supports that they would need to be successful and to participate equitably in distance learning. Our schools have also been identifying and monitoring students that were not able to participate fully in distance learning, again, trying to get them reconnected in the spring. But as we wrapped up the school year and wrapped up stage 3 of our process, all of our schools have reported information on the individual students that they have identified in their schools that are going to need additional learning supports in the summer and in the fall. And that information is highly actionable information and is being used to provide supports both this summer and next school year so that we don't lose any time in reconnecting and supporting those students who need our need our guidance and help the most. Additionally, next school year on those academic support sides, we're going to be providing resources and materials that can be used in Tier 1 instruction, which is in general classroom instruction with whole group or small group or individual student supports, and then providing those individualized interventions in Tier 2 and Tier 3 supports as well. So we're putting together professional development that will help our teams in these areas, as well as ensuring that our teams have the skills and the resources necessary to provide the social emotional learning and health and wellness supports when our students return. So that really takes us to the social emotional learning and mental health resources that we're putting in place. And I think the most important thing here is to understand that we're going to provide frequent, if not daily, social emotional learning supports to our students in the fall in whatever school operating scenario we're under. So that's going to include things like frequent check-ins, morning meetings, providing supports during advisories and intervention blocks. And again, working with all of our staff to provide these supports. So beyond just what's going to happen in those general classroom settings, we're going to have clinical and counseling staff who will provide those Tier 2 and Tier 3 supports for students who might need something more beyond what can be provided in a general classroom setting. We're also purchasing a screener that will help us identify those students that need additional supports, and making sure that we're working with our specialized staff, like our school psychologists, who can provide those Tier 2 and Tier 3 supports to students and parents on a more depth and breadth than what can be provided just in general classroom instruction. So now we're going to take a look again just at our 3 scenarios as they've been updated since the last presentation. And the first scenario that we have is, again, virtual learning for all students. And this would be used just in the event if we had a resurgence of the COVID-19 virus that would cause us to close a school or schools across the division. The model, of course, would be a 4-day per week model of synchronous learning with 1 day a week of asynchronous learning time. And the big nugget here is that the amount of synchronous learning time or interaction time between teachers and students would be at least double the amount of time that occurred during distance learning in the spring. In scenario 2, again, this is just a reminder of some of those health and safety protocols that we'll have in place to ensure that all of our students can come back who want to come back to school and feel safe doing so. And we had a next step request that asked for how we might be able to schedule students in scenario 2 in the same families to keep students together across the same grade levels, or across, different grade levels or in different classes. So the way that we would do that is we would start by assigning all of our student schedules alphabetically. And that would allow us to have families that have students, again, in multiple schools or multiple grade levels, to have their students attending on the same day. So again, you see the key model here that we've provided is this model of a 50% of students returning for in-school instruction, and those instructional days alternating. So one group of students might come to school Tuesdays and Thursdays and be learning at home on Wednesdays and Fridays in what we call an online or asynchronous environment. And the other group of students would come to school on Wednesday and Friday and attend at home online asynchronously on Tuesday and Thursday. And one thing that you'll notice that's different in this model from what we covered on the 15th is that we've moved the day of intervention and teacher planning from Friday to Monday. And the reason that we did that is after further looking at the calendar and hearing some feedback from community members, we realized that there are a lot of holidays that fall on Mondays. And we want to make sure that we're optimizing the schedule to bring students back into school as frequently as possible. So if we build the Monday day into our calendar for that intervention and teacher planning time, that will help us with those potential conflicts that we would have had that would have caused us on a Friday, if we had the intervention time and planning time on a Friday, to lose those additional Mondays. Additionally, those Mondays are one of the best days that we have to maximize our schedule because it is also one of the federal telework priority days. And we think that people would also in our community have opportunities to provide their own childcare on Mondays. So just a few other key points that we wanted to mention about scenario 2. This model really provides, again, a minimum of 2 days per week of in-school instruction. And as we start to actually complete the registration process of students and understand how many students might be enrolling in full-time online environments, we might actually be able to increase the amount of students that we would bring back for daily in-school instruction. So maybe instead of bringing students back only 2 days a week, we might be able to bring them back 3 or 4 days a week.
Exactly.
And then as Dr. Brabrand had also mentioned, that we're also looking at trying to figure out where we might have some flexibility to assign students and staff across different schools and different pyramids or different regions to really maximize our ability to get more kids back in school more frequently if that's the option that they would choose. So again, last time we looked at what a possible layout might look like in a classroom with social distancing. And we talked about what social distancing would look like on our buses. So we talked about the need, obviously, to make sure that students who are on the buses are following health and safety protocols. So we would assign students to particular bus seats, and we would ask students to wear masks while on the bus. And of course, we'll have frequent cleaning of all of our buses throughout the day. And what that means is that with reduced ridership capacity on buses and the need for additional cleaning, we do anticipate that we'll need additional bus runs, and that we probably are going to need to have some additional schedule adjustments to our bell schedules as well. So here you can see what those proposed bell schedules might look like. And we are really asking, and will be communicating in writing to our families, that we would really encourage, if possible, if families are able to do so, that they utilize non-FCPS transportation methods next year. And if enough families chose to do that, we might not need the additional adjustments to our bell schedules that you see here. We also had a next step request to consider the ability to provide full-time online program enrollment to any student regardless of medical need. And as we've discussed, we've made that modification to do that. And here you see that there are a couple different conditions and requirements for the division by creating that flexibility. So the first is, if we're going to provide full-time online learning option to any student, we also need to match those student requests with teachers who would be available to request a full-time online assignment as well. And as we said, the student requests will drive the need for teachers to teach in either an online environment or in a face-to-face in-school environment. And we'll work to make sure that any teacher who wants to can request that online assignment, and we'll be working to tier those placements based on, again, an individual teacher's medical need, their family medical need, and then their preference. Now, on the family side, there are a lot of additional things that families need to consider about this option as well. The first is that we really need our families to submit their intent to register for an online program or an in-school program no later than July 10th. And if we have board consensus for this approach, we'll be pushing out a letter to families to help them understand more about those options and to complete the registration process online by July 10th. And it's really important for us to get this information early because we have a lot of logistical and operational planning to do. And because of the amount of changes to our operations, we're asking families to commit to a year-long program if they opt for online next school year. And this is going to require families to make that commitment. We know that that's going to be difficult to do, but because of the logistical challenges in establishing essentially two different operating methods, one in person and one online, there's a lot of work that needs to be done in a very short time. And there's not going to be an ability probably for us as a system to transition students quickly and easily between one system and the other. Additionally, we just want to point out here, again, that we might have slightly larger classes in our online program as we work to minimize the schedule conflicts and create schedule flexibility for our students. But that actually could be a positive because it might allow us to bring back more students for in-person instruction who would prefer to be in person. We, of course, would not go above the state requirements for class size caps, but there might be less balance in the class sizes than you would see in a normal school operating status. And then finally, as we mentioned, and we just want to point out that we can't guarantee that all programs and course offerings will be available because we do anticipate that we will have some scheduling constraints, but we would certainly do our best to satisfy as many course requests as possible and certainly ensure graduation requirements for all of our high school students could be met. So just a little bit more information on what this program in scenario 3 would look like. I won't go into the details. We've discussed this previously, but the main points here again, that students would be full-time online learners 5 days a week with 4 days of synchronous support from teachers and 1 day of independent or asynchronous learning. And again, our schedules at the middle school and high school would follow those schedules at our base schools.
And Dr. Presidio, this is Dr. Brabrand. I think for just checking our time too, you can highlight now that you've gone over so expertly the 3 scenarios, some of the key new pieces that are in the remaining slides. And you've done just an excellent summary of that just as a FYI. And I know there's some next steps too to share.
All right, thank you very much. So additionally, we had a next step request for information on who's leading our technology efforts. So again, Marty Smith, as our Chief Operating Officer, is currently supervising the IT department and working with the 3 senior IT directors. But we also did want to mention that the members of the Superintendent's Advisory Council have been very active and supportive of our efforts with respect to all of our technology operations this spring, and have been working very closely with us to make sure that our vendors are going to be able to provide reliable services for next school year. So members of the council are looking at our contracts with vendors. They're looking at those service level agreements and making sure that we have their expertise and their counsel to ensure that we have optimal performance and reliable performance for next year.
And Sloan, just on that one and to the board, I want to remind the board and our community that we had no load issues with Collaborate Ultra. Our load issues were with the Blackboard 24/7 Learn platform. And we have worked very, very carefully with Blackboard to make sure that we can handle the load in the fall. In fact, they had 850,000 concurrent users from a single deployment region during the same period of this late 4th quarter when we had no issues. So we are very confident about moving forward with Blackboard Collaborate Ultra for the fall and continuing to also use Google, both of who have assured us that they can handle the loads associated with the virtual options. Thank you, Dr. Presidio.
All right, thank you very much. So just a few things that we want to mention with supports. We're trying really hard to provide supports that staff and students and families need to be successful next year. So with respect to supports for staff, we want to make sure that staff feel safe and comfortable returning to the workplace. So we have a lot of flexible leave work and options that we've discussed previously. We're working to ensure that staff have the PPE that they need, the health and wellness supports, and the training that they need as well. And we do understand the need for childcare and are continuing to investigate and explore any opportunities that we might have there. We had a next step request to look at changing the deadline for staff commitments for next year. And we did do that. The deadline has been extended through June 30th of this month, and all staff have been notified of that extension. And the HR team stands ready to support staff with any questions or concerns about that. And then supports for families are critically important. Our families have to have first and foremost the information that they need, and then the supports and resources to feel safe and comfortable sending their students back to school next year. So we're continuing to look at food services, language supports, and training and technology supports for our families as well.
Yes.
We had a next step request on childcare and what's happening at the county with respect to SAC. So the county is continuing to look at what options that they have for SAC for next year, and we're in constant communication with them. We do know that pre-COVID, SAC did have some space available, so we'll continue to update the board on any developments with SAC. And then we're also working with our county partners to look at other opportunities for childcare through private providers in the community. And there are 2,000 current private regulated providers in the county. Many of those are open now, and many of them do have vacancies in their programs at various ages. We had a next step request for more information on our communication plan and how stakeholder input was going to be considered in finalizing the plan. So a lot of information here, but the main thing I think that I'd like to point out is that beginning in July, as Dr. Brickbrand said, we'll be providing weekly communications to the board, to parents, and to staff about our return to school updates. And we have been doing a lot more two-way communication recently through things like town hall events and through surveys of all of our staff members and community members to get their thoughts about returning to school. And we've posted the complete information on those survey results to board docs, but just a few things that we wanted to highlight. The survey did close on June 19th for both families and staff. We had about a 2/3 response rate for both our families and staff, which is an incredible response rate when we look at the typical response rates that we get in FCPS. And that breakdown, I won't go into the details, but here you can get information on the response rate as compared to the total membership when we look at certain student groups in Fairfax County. And there were just a couple nuggets that we wanted to highlight with respect to the family data. The first is that 51% of our families indicated that they're comfortable or highly comfortable sending their kids back to school next year in person. But 42% of our families indicated that they were likely or highly likely to select full-time online enrollment next year, which of course suggests that they're less comfortable sending their students back to school. On the staff side, it was really evenly split. 43% of staff indicated that they felt uncomfortable coming back to work, and 43% said that they felt comfortable coming back to work with social distancing guidelines in place. So again, the opinion really split there for staff. As we wrap up, just a reminder of the budget request that we've put together for both the FY21 operating budget and the CARES Act, and Ms. Burden can answer questions on that. She did receive a next step request for the budget process for the CARES Act. And I would just point out that the timeline here, it's really important to note that we right now are in the process of having to begin to draft that budget narrative and put all the information together, and we'll need to submit that budget in a matter of weeks. So with that, we're going to just quickly remind folks of the superintendent's recommendations and the timeline that we have for key decisions coming up this week, and the notification of families and teachers submitting their intent for next year, and some communication timelines for when we want to provide information about registration confirmation for families for next school year in August on the 10th, and then the week of the 17th. And I'll turn it back to Dr. Brabrand.